Good evening, everyone. Today we are going to have a quick interview with our AML rank number 10, that is Dr. Anusha. She is with me here. Anusha, congratulations, first of all. The most important thing that I have learned from you is the sincerity and dedication that has been there and consistency in the effort that you have put that has been there. So I'm very proud of you that you got this far and you got a great rank, and there is a much better future ahead. So before we start, Anusha has been my junior resident when I was a faculty at Father Medical College, Mangalore. So that's where we start long back, and then we went forward. So before I proceed further, Anusha, welcome. Uh,
Thank you, sir.
Please tell our viewers about your background, where you're from, what you've done, and what you've been doing right now.
Good evening, sir. Actually, I did my UG from Bangalore Medical College, 2011 to 16 batch. You were my PG back then also, but I don't think you remember me from those days. And later, I got into PG at Father Mulla Medical College, that is in Mangalore. So there, that's where my interest for medical oncology started. And after that, after finishing my degree, I was working at Sri Shankara Cancer Hospital in Bangalore, where I was rotated between hematology, BMT, and medical oncology departments.
Oh, that's great. So, before I proceed further, most of the students are still wary of taking medical oncology as a choice for DM. So, why medical oncology? What probably inspired you with all the other fields that are bustling in Father Muller's as such?
I think the main reason is you, sir, because when I came into medical oncology, like all other MD medicine students, I was also apprehensive of the branch. In fact, I wasn't sure how I would get through those 1.5 months. But after finishing it, my perspective totally changed. So mainly two things. One is it is the closest branch to medicine, like you kept mentioning, and secondly, it has a lot of cure rate, and most of the leukemias and all that has a very high cure rate, and the satisfaction you get by treating those patients, I don't think is paralleled in any other super specialties. These were the two
Absolutely
main
right.
reasons.
Yeah, absolutely right. So most of the students, when even when I was probably taking up medical oncology, my mentor, I had asked him how probably he would go through the day. You know that things are probably bad, and how probably you would end up having a good day. So he would tell me that probably out of the 10 students that 10 patients that we see, four, yes, maybe they are palliative, but you do them give them a good comfort, okay, till the end. Four have a high possibility of cure, but you know that they can probably relapse. But then there are these two patients, probably in case you were not there and you would not have picked up, they would have never survived. Okay, and that for them, that is the difference, and that is the sheer joy you wait every day to see such patients like leukemia, lymphoma, germ cell tumors, early breast cancers. Okay, all of this. So it is these malignancies which probably you need to pick up, and over and years when we go and we'll end up having a higher cure rate. So even I was very initially, but I enjoy my field even this day, and probably in case even after 15, 20 years, you ask me, I think medical oncology would still be the subject. And definitely it's the most closest to medicine. Most of them, most of my seniors would end up telling nephrology being the closest. Yes, probably the medical perspective, yes, but the variety of cases that we see every day, you end up seeing each other organ system. So yesterday I had a patient with MI, and I had to pick up and make a diagnosis of MI. So it happens that you end up refreshing your cardiology, you end up refreshing your neurology, you end up using a lot of gastro and respiratory medicine as such. So multiple other fields do come into play. That is how it is. So tell me, how did your preparation start for oncology as such?
Actually, initially I was little confused between neurology and medical oncology. So, and we also had a lot of confusion about this NEET SS and the
That's right.
pattern, change of pattern and all that. So, if for the initial 6 months I couldn't concentrate much. Later, I started with a systematic preparation. I started making notes from Devita as well as from Terito. Devita, only the major chapters I covered. Terito, almost the entire manual I had finished on 6 months back. And I also had separate pharmacology notes for all the chemotherapy agents. So every day, one drug I would try to cover and make notes from all possible sources.
Right. Fine. So how did you come to know of doc tutorials as such, and where probably we kind of went forward?
Coming from medicine background, our medical oncology knowledge is very limited. So I wanted some basic steps to build up my knowledge on this. So that's where the doctor tutorials videos help me a lot, because the basics would be covered very well. And after that, with the extra information, we can always read up and try to build up our notes. And that's how doctor tutorials help me in my preparation.
Yes. So I think you've been a part of the doc tutorials team for the last 1 year or so now, right?
Yes, sir.
Yes. Okay, fine. So, what were those really important topics probably you felt made an impact and probably helped you go about?
One thing is, sir, the knowledge of hematological malignancies, like comparatively, it is lesser among students. So I try to focus more on that. And since I was working in the same department, that also helped me. And coming to the videos, the QRP videos helped me a lot. And during one of my previous INISS attempt, I lost it by a narrow margin. I lost it by 4 marks. So that's where the recall sessions, I try to go back and find out where I was going wrong. And your recall sessions help me with that as well. So all these help me to build up a better mark this time.
Right. I think the QRP and recall sessions have been the most appreciated ones. Tell our viewers now, how was this year's INISS? Probably it is always difficult to predict, especially after the NEET SS pattern has changed. It becomes difficult for one to prepare for INISS. But how was this year's INISS? Even we've found it difficult to predict on how the theory would be. But just give them an outlook of how it was.
Personally, sir, I felt this time's INSS was completely different from the previous two attempts that I've given. It was more of one-liners and more of history-based questions and a lot of unpredictable questions. And also, even the simple questions which used to seem simple at first sight were actually confusing in a way.
Right.
So, like one of the question was that where GVHD prophylaxis, the high dose methotrexate was mentioned. That was one of the mistakes that I had also committed.
Right.
So, pattern seems to be changing. One thing is we need to focus on the question, go through word by word, and try to identify the exact answer. If we identify the question properly, I think the answers will come easily.
Yes, there's always a very fine line between the options that are given. So it is usually made in a way that you think twice, probably you'll get it right. So that is how it is. Yes, the patterns keep changing. Last year, we know the focus was more on molecular concepts, was more on IHCs and multiple, more deep into the subject. Where this year it was much more practical based. So probably somebody who had worked in the Department of Oncology would have a slight advantage over somebody who would have just gone through the theory. So I think you have working in Shankara before and even pursuing DNB now. I think that made a difference,
Yes,
right?
sir. Definitely
So
that helped a lot.
yeah, so I always believe that medical oncology is one subject for two reasons. One, to understand the subject better, that you it's always better to work in the field for some time. Understand, because the first time even I was not sure why Winkliston is given on day one, day eight. I could not understand this day one, day eight concept. It's just a week apart, but even those fine concepts like the numbering of the days would keep you confused. So, working in the oncology field gives you a really good background of how to go about it. And second thing, you'll start knowing that are you really liking the field or not? Because there are quite a few dropouts, especially in the need. They end up taking up oncology, but after some time, they probably feel this is not for me. Okay, so I think it's very important and extremely pertinent that one probably works in the Department of Oncology anywhere. It doesn't matter, either with some private physician or an institute, that you work for some time, know how things are, and then proceed. Right. So that was about the theory aspect that you told. Now, how was the interview and how was the build up for the interview?
The interview, I think I had very good guidance from you as well as the entire doctor tutorials platform, sir. And you prepared us for the worst. So, like you said, the interview was much more simpler compared to what you had trained us to. It was a very short and crisp interview, so it was very basic for me at least. They just asked me about my thesis, my work experience, and also one case scenario that was a SVC syndrome that they had asked. and they were very much to the point. So we had to answer whatever questions they asked, and that was the end of it.
Right. So interviews are extremely focused there. They do not end up asking you really hi-fi stuff, nothing too up to date, okay, nothing about new trials, none of that. They basically want to know that you end up coming as a resident. What would be what would be the expectation out of a resident is to pick up, say, cases like SVCO and manage appropriately, work them up properly. So most of the time, the interviews are much more brief, to the point, have high impact as well, and it is utter basic that they end up asking. And the mock interview session that we did probably kind of gave you an idea, especially about the thesis and the statistics part. That is something they've been consistently asking. So that is what probably I would tell other students as well. The theory is variable. It can make a difference, but some experience in oncology is always kind of expected, and the interview goes much more simpler way. Fine. So, Anusha, that was about your theory and the practical aspect of INISS. Now, how does it feel after getting ranked 10 on AIMS?
It's almost unbelievable, sir. I had already given up on INISS. This was my final attempt, and it feels surreal. I really cannot believe it. And I
Yeah,
think much of it is because of you, sir, because you kept pushing me to pursue this. I think you
yeah,
were one of the first staff who encouraged me to take up
yeah.
super specialty. So thank you for that, sir.
Thank you. My parting gift for Anusha. Anusha was the topper as well as Father Muller's. So my parting gift was the Casieto Tirito book, which was given to basically by my mentor, and the updated version is what I had given her. But it is
And that
not
only
that. It is
mentions
just that. Yeah, it is
and the
just
only
that.
on the first page.
Thank you. It is not only that probably we were the most important ones. It is never that, but it is always good to be a part of somebody's journey, because it just refreshes the same feeling when I kind of entered my DM. The effort that we put, that's all matters. There's always light at the end of the tunnel. It's just that you need to have patience to see the light. Most of us end up giving up, thinking that probably this is not for me. This is There's so many other things that come into play. Family comes into play, your personal life comes into play, the years come into play. So it is always a very tough decision as how long you should keep pushing, how much effort you need to put. There should be sincerity and dedication, all that matters. It is good that we are happy to be a part of it, but a lot of effort I know has come from you, and that consistency is the most important one. That you end up feeling like giving up and this is not for me, but still probably you come back and do it. That is what Anusha has taught us, that probably for us also to work better, make better efforts to see many of our students get placed in aims again. uh, Thank you, Anusha. That's it from me. Uh, but always happy to have you back since UG, since PG, and again finish DM and come back in the field of medical oncology. And definitely, as colleagues, somewhere we'll have a nice conference, have a cup of coffee, sit and tea,
Yes.
and probably have your dog by yourself as well.
Yes.
Okay. Uh,
Thank
Fine.
you.
Congratulations once again, and we wish you good luck for your future. Thank you.
Thank you.
That is from me for medical oncology. Short, crisp interview with Dr. Anusha, AML ranked 10. Thank you from the team, Dr. Tuvils.